Bill Gates, How to Prevent the Next Pandemic. Embark on a journey to understand how we can better prepare for future pandemics as we take a look into Bill Gates, How to Prevent the Next Pandemic. This book summary delves into crucial aspects such as the importance of widespread testing and efficient contact tracing practices, as well as learning from the experiences of countries that successfully managed the COVID outbreak. Drawing inspiration from fire departments, the author envisions a global institution dedicated to fighting epidemics, global epidemic response and mobilization. Discover how innovative approaches in disease surveillance, faster vaccine development, periodic outbreak preparedness exercises, and bridging global health inequality can strengthen our defenses against the next pandemic and prevent history from repeating itself.
Effective responses to pandemics. The recent COVID-19 pandemic has revealed how countries that had previous experience with outbreaks responded quickly and successfully. Countries such as Singapore, Taiwan, China, and Vietnam had efficient systems in place, including rapid testing, tracing of potentially exposed people and the isolation of positive cases. These three strategies worked effectively in limiting new cases of the disease. On the other hand, the US failed in these three areas, leading to chaos and inconsistency in the rollout of mass testing. In the future, it is important that countries prioritize preparation in advance of outbreaks through centralized testing, the isolation of potentially infected individuals, and tracing of those coming from abroad. Large-scale testing will be a crucial tool in managing future pandemics, and therefore, the world needs to invest in the necessary systems and tools to ensure preparedness and prevent large-scale casualties. A global emergency squad for pandemics. The book proposes the need for a global institution dedicated to pandemic prevention. With the example of firefighters, who are equipped to handle rare events like fire outbreaks, the author argues for the formation of a global epidemic response and mobilization, to coordinate pandemic responses at a global level. The team consists of specialists who are responsible for identifying potential outbreaks, raising the alarm, and advising governments on necessary measures. The team would coordinate various national health organizations into a single, integrated global health system rather than treating people independently. The author argues that such an institution is necessary to avoid the every state for itself approach seen during the COVID-19 pandemic. Disease surveillance, monitoring for pandemics. Disease surveillance is the practice of monitoring outbreaks and tracking the spread of diseases in populations. The data collected helps inform public policy and guides treatment protocols. Disease surveillance comb through cases to identify potential outbreaks, requiring good data and proactive testing to detect symptomatic and asymptomatic cases. New methods for data collection, such as searching for pathogens in the environment and social media scanning, offer innovative approaches to disease surveillance. Sharing and accessing data over large regions, like what exists in Africa, is critical for global health. The creation of a global hub for disease data, like the proposed team, could improve the likelihood of detecting and containing outbreaks. Disease surveillance is essential to preventing future pandemics. Advancing vaccine technology. This book summary explores the need for advancing vaccine technology and the potential innovations in vaccine delivery and development that could revolutionize our capacity to vaccinate people. Disease surveillance is the critical first step in any pandemic prevention plan. To combat a disease, we must first know that it exists. The COVID pandemic taught us that we can create vaccines within a year, which was unprecedented in the history of medicine, making vaccines the great success story of the COVID pandemic. However, we must strive to improve vaccine technology to avoid large-scale lockdowns. To achieve this, we must find innovative ways to speed up the development, manufacturing, and delivery of vaccines without compromising safety. Achieving this requires funding, research, and a system for nurturing innovation in healthcare. The team could oversee and coordinate research globally and funnel government funding into the most promising new ideas. Exciting innovations in the pipeline include vaccines that don't require needles and can be administered using nasal sprays or microneedle patches, ones that don't need to be cold, and ones that require a single dose but protect against entire virus families. Advancements in vaccine technology could revolutionize our capacity to vaccinate people, particularly in poorer countries. In conclusion, although the world was fortunate to produce vaccines against COVID so quickly, we have only scratched the surface of what we can achieve. We need to pursue an ambitious research agenda to improve vaccine technology as soon as possible. Pandemic preparedness. The world was ill-prepared for the COVID-19 pandemic because of complacency brought about by the lack of major pandemics in the past century. To prevent this from happening again, practice exercises should be conducted periodically to test global response systems and keep them alert. While drills are commonplace for other crises, they are not as frequent for pandemics. The GERM team could assist governments, health institutions, and military leaders in undertaking these exercises by providing advice, reviewing performance, and even offering resources. These exercises would simulate a serious illness outbreak, monitoring the region's progress in setting up systems for testing new cases, analyzing the pathogen, and reporting data. After the exercise, GERM would review the findings and identify weak points to improve the system and create recommendations. Pandemics should be treated with the same importance as earthquakes and other disasters, and preparedness exercises can help in responding to them. Inequality in global healthcare. Inequality in global healthcare is a deep-seated problem highlighted by the COVID-19 pandemic. Low-income countries suffer from limited healthcare infrastructures, which prevent vital medicines, vaccines, and treatments from reaching the people who need them. Furthermore, the pandemic has revealed that the world has not yet achieved equality in healthcare. Black, Latino, and Native American people in the U.S. were twice as likely to die from COVID-19 compared to white people. Globally, almost 100 million individuals were forced into extreme poverty in 2020, with low-income countries receiving less testing, treatment, and vaccination. The wealthy countries can aid in closing the global healthcare gap by investing in health infrastructures of poorer countries. Although the project is a long-term one, beginning now can better prepare us for future pandemics.
In the quest for improved pandemic preparedness, How to Prevent the Next Pandemic offers insightful lessons, ideas, and solutions. The essential elements to be gleaned include the necessity for rapid testing and contact tracing, the creation of a global institution like GERM to coordinate and track diseases worldwide, and the implementation of innovative diagnostic, monitoring, and vaccine development methods. We mustn't forget the importance of global preparedness exercises and addressing the issue of health inequality among nations. By prioritizing these measures, we stand a better chance of tackling future pandemics and safeguarding the world from unexpected catastrophe, ultimately improving global health for generations to come.